Now, cervical cancer is a disease condition that affects women. This means that very dangerous cells have occupied where good cells used to be, particularly in the cervix.
So, if you look at these risk factors, you're wanted on one. It's either you've not been vaccinated or you have multiple.
Some of you are wondering, oh, I don't have multiple sexual partners. I've never even done it before. I'm just keeping myself until the Lord's day. But some of you virgins are doing very nasty things with your mouths.
Hello.
It's Dr. Benicia here.
And your favorite celebrity, Dr. Nelson.
And you're welcome to Health
Wahala.
Wahala.
You guys are welcome. You guys are welcome. I've only said it's been a long while.
Yeah, I've not seen you since Christmas.
Yes, how have you been?
The going keeps going.
Hope you had me to start. Okay. Let's move. So, guys, as you all know, we're in January, and January is Cervical Awareness Month. Basically, not just the surface, the cancer involved. So, it's Cervical Cancer Awareness Month, and today we're out in the streets. Goodness, how was it, Dr. Vanessa?
You guys, so many people said they were camera shy. The reason for being out in the streets is because we don't want to sit over here and assume that a lot of you know what cervical cancer is or what you need to do. So we went to the streets just to get insight of what the population think about it. So many people were like, "Oh my gosh, I'm camera shy. Oh my gosh, I don't want my mom to see me. I don't want my boyfriend to see me."
Well, it was a lot, but thank God, gracefully, we had a lot of persons that were not camera shy and were willing to share
Yeah.
what they know, the basic knowledge they have about cervical cancer with us. And it was awesome. It was amazing.
Yes,
So, back in the studio here to give you guys the full details of what cervical cancer is. And you can only get this from just one podcast, and that is
Health Wahala. So, guys, today we're going to be talking about cervical cancer so that you can understand what it is and what you need to do. So, we're going to be talking about what it is, how do you get it, how do you prevent it, what do you do when you already have it, and make sure that you're coming to this podcast with your common sense.
like, we call it CS, common sense. Don't leave it at home.
Don't leave it at home.
Good. So, Dr. Valencia, could you just enlighten us a bit about cervical cancer?
Definitely, that's why I'm here. Let me shift my nerdy glasses, okay? First of all, introduction. Anyway, first of all, cervical cancer, like Dr. Nelson rightly said, this is January is Cervical Cancer Awareness Month. So, what is cervical cancer? I'm going to try to explain it in the simplest form, no jargons, nothing you can understand. Now, cervical cancer is a disease condition that affects women. And this means that very dangerous cells have occupied where good cells used to be, particularly in the cervix. Don't worry, particularly in the cervix, we're going to leave a picture and a diagram for you so that you can fully understand that. Particularly in the cervix, if a cervix is a part of the female reproductive organ, it's somewhere between the vagina and the uterus. That's between the vagina and the uterus or the womb. It's like a doorkeeper. So just that small area can be turned from normal cells to cancerous cells, and it particularly happens to men. Why? Because men don't have cervix. Do you want to answer that?
Okay, so I will just give you a rundown of basic causes of cervical cancer. So first, one of the basic causes of cervical cancer is when you have a family history of cancer, and maybe your mom, your grandmom, your sister, someone in your family lineage has cancer. It's a predisposing factor to having cancer. Two is when you have multiple sexual partners, when you have more than one sexual partner, or when you're faithful in a relationship and your sexual partner has more than one sexual partner. These are predisposing factors to cervical cancer. Thirdly, is if you either smoke or take alcohol, things that can compromise your immune system, it predisposes you to cervical cancer. If you have underlying disease like HIV, AIDS, diabetes, all those things can also weaken your immunity and then predispose you to having cervical cancer. So these are the basic causes of cervical cancer in our environment.
So additionally, like Nelson has said a lot of risk factors. Additionally, one of the things that is implicated the most, the major causative factor, is an infection through that is caused by the HPV. A lot of us have heard HPV this, HPV that. So human papilloma virus, okay? And some of these risk factors, like having multiple sexual partners, predisposes one to contracting that HPV because it can be sexually transmitted. I know some of you are looking at me saying, I've never had sex before, but you're doing a lot of wonders with your mouth. You're putting it in places that it has no business being.
This mouth should just worship the Lord.
But no, you're putting it in different directions and you're wondering, it could also be part of it. So that's all you really need to know when it comes to some of the causes. So there is no one known cause, but there are risk factors that would predispose one person to having the cervical cancer.
Of course, yes. There are cases where patients can be asymptomatic and then show up at the early stage. So that is why you need to come and get yourself
Screening
screened.
done.
Okay, so when your screening is done, that's where we can detect if you have the virus or you don't have the virus. So the virus is the causative organism that causes cervical cancer. So when the screening is done and it is discovered that you don't have the virus, then you go ahead to get vaccinated to prevent contacting the virus. But if the screening is done and the virus is detected, early detection is key. It helps us move to the next line of management of action. So it can be asymptomatic.
Yeah, meaning that the patient can present and have no symptoms. But additionally, in addition to what Dr. Nelson has said, there are women, I feel like a lot of women, not I feel, I know statistics have shown that so many women actually have HPV virus. But what happens is that they have very strong immune system that gets this thing sorted out, but not every woman is lucky, which is why you must take screening very
Very seriously.
seriously. One of the early signs to know is that so many women might bleed right after sex. So you've had sexual intercourse with your partner and you're bleeding right after.
It's called postcoital bleeding.
Postcoital bleeding, meaning after sex bleed. So this is what, don't take it lightly. When you see it, don't think of anything. Just make sure you come to the hospital to get that checked out. Then sometimes when it progresses and the woman has not done anything about it, as the cancer progresses, the woman can lose a lot of weight.
Of
She may
course.
experience a lot of weight loss, foul smelling discharge.
Very important. When you have all this fast smelling discharge and then you're just thinking it's normal. It's not normal. That is why the hospitals are open 24/7. Go get yourself checked. Men are carriers. It's
The way you
unfortunate
said
they
it.
don't have service. But men are carriers.
You men are giving a lot of things. It's not only money
We
they
are
give.
givers.
It's only men are giving. You see how to say men
We
are
are
providers. They give a lot
givers.
of
We are
things.
givers.
So
So
add this to your deal breakers. If you have HPV,
of
how would they
course,
know?
the
Pap
pap
smear
smear.
in Nigeria, HPV screening, of course. But these days we do them together. We do them as a collabo.
Yeah. Well, it differs. Some persons would say at from 9 years, but some other persons will say from 25 years. But I think the best is for puberty. The earlier, the better. Once you started noticing
Most men will
puberty
not
stage.
allow their children to go
Yes, I think that's a controversy on that because at those age, the ladies, most of them are virgins, and then you wouldn't want
to
to be,
have that experience. So many there's so
so
many controversies.
yeah. So, but what do we know? Sometimes you think these girls are virgins, but
Well,
well,
so
we're not saying they are not,
so
but
statistically, we're going to just say what is the statistic. All right. So, like he said, when a lady becomes sexually active, but if you're looking for an age, there's so many schools of thoughts. One will say from 25 to 65, but you should make sure you get yourself checked every 3 to 5 years. Some will say every 2 to 5 years. So, basically, HPV just simply means human what?
papilloma
Papilloma virus.
virus.
So it's a vaccine that is given with the goal to help individuals, women particularly actually, to prevent them from contracting the HPV virus. Why? Because contracting the HPV virus would make for a risk factor for an individual to have cervical cancer. So we're trying, the saying now, prevention is better than what? Cure.
Cure.
So the HPV vaccine is a way to prevent you from contracting the cancer. So if you're watching this right now, you're like, no, I'm not gonna take it. Better run, clean, dust your slippers, and run to the nearest teaching hospital or general
But Dr.
hospital.
Venetia,
And
what do you think? This HPV vaccine should be added into the immunization schedule for women. So, as a woman, if you've not gotten the HPV vaccine, you're not fully immunized.
oh, that's a very brilliant idea. So you know how with the immunization schemes that we have in Nigeria, some of them range from 0 to 12 years. So we can even add this thing and extend the number of years so that way there'll be a data in the country to be able to assess those who have gotten the vaccine, who are getting screened,
Of
and all of
course,
that. It's a brilliant idea. Please, if you're willing to collaborate, the government, anyone willing to collaborate to make sure this happens, Health Wahala is open for this.
we're
Okay.
open for collaborations. Interesting question.
Yes, it
So,
is.
there's cervical cancer and there's cervical virus. So, the cancer is the end product, while the virus is the trigger factor. So the virus is what causes the cancer. Once you now have the cancer, it's no longer contagious. So it is the virus that predisposes you to having the cancer. So the virus is contagious, but the cancer is not contagious. So I know people will be worried like cancer is different from the virus. So the virus leads you to the cancer. So once you've had the cancer, you go for treatment.
It's your first response to having cervical cancer is going to the hospital. Why? Because someone has been professionally trained to handle that. And cancer is not just about the disease, it requires multidisciplinary input, meaning that doctors from various departments would have to work hand in glove to help you achieve remission.
I think the best thing they should know about treatment of cervical cancer is go to the hospital once it has been detected.
Simple and
Then the
short.
hospital will not draw a line of treatment for
Exactly.
you.
There's a
So there's
protocol
no,
to
you're not
treat
staying
you.
at your house to treat it. You're not going to buy over the counter
You're not
medications
taking a
for.
bow
Mm-mm. And I know that somebody in your village will be telling you that there was somebody I know that has suffered
and the
cervical
Lord
cancer.
and the Lord turned it around.
Yes, and then they drank this particular abo, this concoction. If you mix this with this, it worsens the situation and makes it worse. And before you now present in the hospital, it's end stage. And we're telling you this from experience. We both have worked in cancer centers, and then for the fact, in fact, you're getting this for free. That the best treatment for cancer is early detection. And once
Simple.
you've detected it, please get to the hospital for treatment.
Exactly. And make sure that you get support from your family as much as you can because it's a journey that we don't advise anybody to take alone. And like Dr. Nelson already said, the first step is early detection. And once that happens, run to the hospital. Don't wait, don't linger. Even if you want to pray, even if you're waiting for a miracle, do that in the walls of the hospital. Okay? Yes, it can. Absolutely, it can.
Of course.
The most important thing here is that it should be detected early and you present early to the hospital and get them to give you a treatment plan which you start immediately that will lead to your early cure. Of course, there's been stories of people who have
Of
relapsed,
course, of
but
course.
it's very
I
few.
just think that the basic thing, as you rightly said, is go for screening early. Every 2 to 3 years, make sure that you get yourself screened to your pap smear so that once it's detected and you present early, then you're sure of 60 to 70% cure.
Yes, actually. So and but unfortunately, a lot of people wait at home a lot, and by the time they come to the hospital, this cancer has spread to every other region. It has left the cervix. It has gone to the
And of
vagina,
course, you know what
the
cancer
womb.
cells do.
They
Cancer,
spread.
the meaning of
They're
cancer
very savage.
is
Oh.
rapid metastasis. Once it's cancer, it begins to spread. Like today it's here, tomorrow it's there, the next thing is there. begins to damage the good cells, and then before you know it, you're down. So once it's detected early and you present early,
You can keep it from spreading and
of
then
course, of
start you on
course.
your journey for a cure. So yes, it can be cured once treatment is started early. I'm
Access
interested to
care.
hear your insight on this
All
one.
right, there's a lot of places you can get care. There are cancer centers, there are general hospitals, there are federal medical centers, teaching hospitals, and a whole lot more. Okay, there are private hospitals that specialize in cancer treatment. So check your phone, ask questions, go online. You would find somewhere closer to you, somewhere in your state, somewhere in your local government, somewhere in your community. And ask your friends. Information is at your doorstep. Just ask the questions and then you get the answer.
But if you feel like you're losing your way, there are so many options. It's always best to start with teaching hospitals, general hospitals, and government centered hospitals because there you're going to find professionals who are trained and ready to help you. And if they must make referrals, it's going to come from them. So that is if you feel like you're overwhelmed with the options out there, that is a good starting point. So guys, let's wrap this up.
So, in summary, what we've been saying today, what we've gone out the streets to do today, is to tell you basics about cervical cancer. It's a cancer of the cervix, and risk factors. Its basic risk factor is the human papilloma virus, which you need to get screened to know if you have or if you don't have. Other risk factors are family history. If you have multiple sexual partners, if your sexual partner has multiple sexual partners, if you smoke, if you take alcohol, if you have underlying immunocompromised diseases, these are risk factors and things that can predispose you to cervical cancer. So, Dr. Venicia, do you have anything to add up?
Yes, of course. I want to remind you guys this is Cervical Cancer Awareness Month. And one of the things you need to do if you've never gotten screened before, take your slippers, dust it, and start running to the nearest teaching hospital or general hospital and make sure you get screened.
Screen.
And based on the result of
Screen.
that screening, go and get vaccinated. It's called the HPV vaccine.
You cannot end this January without getting this pap smear done, and you cannot end this January without getting vaccinated if you're negative. So do yourself a favor as a young girl, as a young mother, as a woman out there to go get yourself screened and get yourself vaccinated. So guys, this is where we draw the curtain and we are here to call it a wrap. We've done justice to this and then we'll see you on the next episode. And then you're not doing yourself a good favor if you've not started liking and commenting our videos. You're not doing yourself good. No, 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 no.
Especially this one, share to your
This,
friends, to your mom, to your
this,
sisters, to everybody. Let it be on your WhatsApp, on your Instagram, on your TikTok, on your YouTube, on in fact everywhere. Everywhere.
you cannot hide this video from your mother. If you do that, you're wicked.
So if you've not subscribed, read now, subscribe, like, comment,
And
share. We want to
share.
hear your opinions. We want to what do you think we should talk about next time? Because remember, we're serving you guys, okay?
This is Health Wahala. Where health and Wahala meets together.
And it's still your
Celebrity doctor.
and it's me, Ivan, is here. So till next time, see you on Health Wahala. Bye.